Hello, everyone. This is Mark Anthony with AI Edge Podcast, the place where we bring you the best of the best doctors in their niche. Today's going to be something really cool. And Dr. Tom is out of Austin, Texas. You can find him at beastchiro.com, exactly how it sounds, beastchiro.com, BEASTCHIRO.com. Today, we're going to be talking about real healing requires precision. A very interesting topic. I'm excited to explore this avenue. And before we do, everyone, I just want to let you guys know as soon as you see this video, let's share it because it's not that old corny cliche, sharing is caring. It's about one video impacting one person's life. Of course, we would love to impact millions, but it always takes that one person because that one person will impact millions. So today we have Dr. Tom. Thank you so much for being here with us.
Thank you for having me.
Oh, totally. I'm blessed and thankful that you're here. I've heard a little bit about your story, and I know that the people here hearing you live will enjoy this. So, Dr. Tom, tell us maybe just a little bit about yourself and about how you got into chiropractic, and then we'll go right into the healing. Real healing requires precision.
Perfect. Well, there's no short way that I've found to describe my story because I never wanted to be a doctor. I was a college dropout, was obsessed with martial arts, and I didn't even get into that until I was 20. And I got into it for all the wrong reasons. I was tired of being bullied, I was tired of being weak, and I just wanted to really learn how to master my body and be strong and be capable of protecting myself whenever I was out. And so I found this school and I just got obsessed. I fell in love with the practice. Kung Fu just really spoke to me. I went around to different schools, different systems, but none of them really connected with my body and how I wanted to move and how I felt like I was actually getting stronger
Right.
by it. And the rest is history. I spent the last 20 years training, fighting, competing all over the world, teaching. It's been such a blast. And then I got injured, and that's what took me out of the scene. I was fighting this guy that was way out of my league, way bigger, way stronger, way better, and he couldn't take me down, and so he wrapped me up and then twisted and fell back. My foot stayed where it was, and it tore all the
Mhm.
ligaments in my ankle. And the doctor afterwards was like, "You're gonna need surgery. You're never gonna be able to fight again, even after the surgery." And I was like, a big F you to that. I'm gonna just keep doing what I'm doing. And so I went into class every day on crutches and just did the Tai Chi stepping as much as I could. And within 6 weeks, I was jumping around again. I
Wow.
was like, "What the heck? This makes no sense to me." Right. And I
Six
would
weeks.
I would always hear it all the time, like, all the teachers that I would learn from, they would always say, like, "You have to be a doctor if you're gonna be a good martial artist," and when you
Wow.
read into this stuff, the martial arts world was created by the doctors, by the Taoist, like, society. It was all created in harmony, it was all one system, right? And only now has it been separated out into, like, this is an external system, this is an internal system, like, this is only when you're doing this is only when you're doing this. And, healing's this whole separate thing, right?
Mm.
And so I would say for the last 2 decades, I've been on this like wild journey of like bringing it all back into one holistic
Mhm.
container, the way that it was meant to be. Right. And that's what led me into medicine. And the more I bring the martial arts into the medicine, the better results I get with my clients, the more sustainable the healing becomes, the less dependent they become on my system, my healing, my me needing to work on them. And then the more I bring the healing into the martial arts, the faster people learn the skills and techniques, the less they get injured and hurt. It's just this beautiful cohesive practice where movement actually becomes medicine. Because we hear that all the time. Movement is medicine, right? But medicine has side effects, right? If you're using the wrong medicine for an issue that's present, you're going to cause negative outcomes, right? And
Yep.
so if you're using the wrong movement or the wrong dosage of movement or the wrong rhythm of movement, then it's not medicine anymore. It's actually harming you. And the beautiful thing about the martial arts, especially in the Chinese martial arts of Kung Fu, Tai Chi, Qigong, it's all spiral. And so when you start bringing these complex asymmetrical movement patterns, this full cross body spiral, a lot of people are getting really popularized into fascia. That's just a new buzzword that's been thrown around in the movement systems and everything. when you start looking at those fascial trains, the anatomy trains, you can start
Right.
seeing these movement patterns on an anatomical level, right? The reality is there is no training without fascia and there is no training only like with only muscle. Everything every time you're moving, you're using your fascial system and you're using your muscular system, right? There is no separating the two from each other. And so the more you can learn how to move in those spiral patterns, the more the body is going to actually heal, flush the lymphatic system, bring all the nutrients where it needs to go, and make the body actually maintain its power and its presence and its capacity to exist. And so this has been the journey I've been on, right? Just constantly diving deeper and deeper into all these different practices from the esoteric to like the cutting edge, modern science and sports medicine, and trying to get rid of all the nonsense that's just a compensation pattern and seeing like what actually works, what
Wow. It's
actually
interesting.
helps
So
people.
when you're saying real healing requires precision, where did that come? Was that kind of more within, or was that something that you taught or you learned from somebody?
I'm a big believer that we don't create anything new. That everything that even if we do come to it, it's a amalgamation of all the different unique experiences that we've picked up along the way. And so
Mhm.
when I think into that, when I feel into that, when you start looking at a lot of the ways that the Chinese martial arts system works on striking and in penetrating and making sure that power is efficient and practical and you can reach the depths to hit the pressure points and everything that you're trying to hit, it's a deep level of precision, it's a deep level of softness, it's a deep level of awareness that you don't have to force, right? And the more I bring that philosophy into the healing world, the better I see the results with my patients. Because if I'm just trying to force healing based on the subjective ability of my patient bringing me their history, as well as my limited objective tests that I can do, whether it's physical, with different tools, all of those things. Like when I start bringing all that together, I still only am seeing a fraction of them, right? I still only see what they have been willing to show me and what I am able to see within their body. And that's it. And there's still so much more happening with them. There's so much more on the physical level, the emotional level, the psychological level, the spiritual level that is manifesting their symptoms. And so the more I can get into it, move everything away, and find that precise thing, which is actually the patient touching the fire, right? The root cause of the burn would be the actually putting the hand on the fire. The closer we can get to that, the more likely that the treatment that we build for that is going to actually work. Right? Because if we're not focusing on that root, then anything we're doing is just superficial. It might make them feel better temporarily, right? Even if I tell my clients this all the time, even if I had a magic wand and you burnt your hand, you came in and I touched it, and then all of a sudden the burn is gone and your hand's perfectly healed. If you don't realize that touching the stove burnt your hand and you leave and you go touch the stove again later, even if it's a week from now, a month from now, 6 months from now, and that pain comes back, did I heal you? I mean, sure, I fixed the acute situation that's present, but you're still going to go and hurt yourself again and again and again. And this is where a lot of patients end up being hopeless, right? Because a lot of medicine, due to time constraints, due to financial constraints, due to all these physical aspects that come on the marketing side and the business running side of medicine
Mhm.
that make it really complicated to actually practice the art aspect of medicine, which takes time, which takes that level of precision, which takes that level of like almost like bringing a detective, a curiosity to the examination, right?
Wow. So when you got into chiropractic, did you always have this type of blend with the martial arts side and the healing of the body, or did that just kind of come gradually?
So I didn't even want to be a doctor. I was just tired of everybody that came in to the school wanted to know how good my system was, right? And the only way to prove that is by fighting them, right? To like prove it and to fight them. I was like, this is exhausting. Like I don't want
Wow.
to live that kind of lifestyle. Like I see my teachers going through that. I see the struggles with that. And then I'm like, well, if I have the doctor title, people will respect me. and they'll
I
listen to me
see.
more, right? And so I just was like, "Oh, chiropractic. I can also do acupuncture as well. I'll have the title. I'll get to learn more about the body and everything."
Chinese medicine, all that fun
Yeah,
stuff.
it's like all wrapped up perfectly. It'll just help my martial arts that much more, right? And then when I got into it, I was like, "Wow, this is actually really cool. It's actually really helpful. I didn't think it actually worked," right? And
Mhm.
so I'm seeing these amazing results while I'm in clinic with clients and patients that are coming through. I'm doing acupuncture rotations in the VA, and we're working on the most wild PTSD and mental disorders and having these amazing results with these guys. And I'm like, this is awesome. Like, how is this working? It makes no sense to me why this is working the way it is. And so I would start searching elsewhere, trying to find the information. I would look at as many studies as I could, and you can start getting into like neurochemistry
Yeah.
and neuroanatomy and start seeing how this stuff is playing out in the neurological system and how the adrenals have impact on things and how all this stuff goes. But the main thing I started noticing is I would use certain protocols that were like meant for fixing X, Y, and Z,
Okay.
right? And then sometimes it would work and sometimes it wouldn't. And it made no sense why it wouldn't sometimes because it's like this person has all the presentations necessary for this to work. Why is it not working for this person? Right. And so then I would start looking outside of chiropractic. I would look outside of acupuncture and I couldn't really find anything. And then I heard a podcast with an acupuncturist. I forget
Okay.
the gentleman's name, but he started incorporating qigong breath work that he was practicing himself while he was working on his clients and seeing really good results, and he wasn't telling his patients that he was doing this because he didn't want people to think he was weird,
Okay.
but he's like, "I have no clue. I don't know if this is just placebo, but I'm seeing a huge thing." And I was like, "Wow, I've been doing this for 15 years at this point, like, I'll start doing that myself." And all of a sudden, everybody started getting better,
Wow.
right? And not just, like, happen chance or anything, they were getting better way faster too. People that were coming in for like treatment for 5, 6, 7 months, all of a sudden within 3 acupuncture sessions would be like, dude, I went to the doctors the other day and they took me off my thyroid medication because my thyroid's back to normal and the medication's hurting me. And the doctor was like, what'd you do differently? And they're like, I started seeing
Wow.
acupuncturists. And they're like, nah, it's not that. What else did you change? They're like, literally nothing.
Wow. Man,
And so
that's
that's when it
amazing.
started really overlapping and leading me down this.
What's some of the biggest things that you've seen that have people have come to you for a neck pain, back pain, and you started realizing, wow, this is working? Maybe like a couple examples.
So I would say one of the main things that people come to me for are shoulder issues. Low back would be next. And that's why I'm always telling people like precision is so important because there's a million reasons why somebody's shoulder can be in pain, a million reasons why somebody's low back can be in pain. Right. And if you just go to a surgeon and they take an x ray and they might see a disc herniation present or l- uh, degeneration in the disc space, they're going to be like, oh, you need surgery. You know, you go to a chiropractor, they're going to say you need adjustments. You go to an acupuncturist, they're going to say, "Oh, your liver chi's probably out." You go to a massage therapist, they're going to be like, "Oh, but your psoas," right? Everybody is so specific to, "Oh, it's this," right?
Right.
And one of the biggest pivotal points that really changed how I started getting results that were sustainable without only needing me anymore, where patients were actually getting better, were when clients would come in with like frozen shoulder, for instance. Okay. And that's supposed to not be fixable for the most part. Like you can, with a long enough amount of work, if the frozen shoulder is bad enough, you can get some range of motion, but usually it starts coming back within 5, 6, 7 months. I was able to start getting their shoulders back to full ranges of motion in a way that they would actually hold it. And the thing that I was doing differently was I was guiding them to the edges of what they can hold. All right. And so yeah, I would adjust the cervical spine. I would adjust CT junction. I would make sure the clavicles are moving. I'd make sure the mid thoracic is unlocked. I'd make sure the SI joints are moving, make sure their arches are working okay and all that stuff. Great. Doesn't always fix frozen shoulder. But when I would start sitting there with their body and connecting their breath to the shoulder joint, bringing them to the edge of that fear, bringing them to the awareness of the fear that they have in their body and bringing that safety to that space, all of a sudden the nervous system can start breaking that chronic fascial guarding that it's in. And then the range of motion comes back. right? And so when you start actually treating the body from a neurological standpoint, instead of just from a physical standpoint, like we're taught in school as chiropractors, as we're taught in school as medical doctors, as we're taught in school as massage therapists, like traditional Chinese medicine is based on this foundation, right? They look at the body as a light particle cloud that's just covered by a meat sack, right? Like your body in through the traditional Chinese medicine lens is a manifestation of what's happening internally at the energetic level, you know? And so you'll hear terms like chi and meridians and all this stuff. But what they're talking about is like my skin is manifesting based on my emotions. The frequency that my emotions are moving at is going to determine the health and consistency of my skin. And if I'm in a deep like grieving state, my lung system is the metal element. It's the armor. It's attached to my skin. My body, my nervous system is gonna lock down to armor me up to protect me, right? And the yang side of the body, the back side of the body is the masculine side. It's the protector. The front side is the yin part of the body. It's the feminine. It's the area that needs protection, right? So the second fear comes in, boom, everything wraps up. Everybody that has had a brother or a friend as a man knows the feeling when they go to like punch you in the stomach and you're like, ah, right? That natural reaction to guard against the hit. Because this is all vulnerable. And so the body wants to guard neurologically, it wants to protect, right? And so, yeah, traditional Chinese medicine has all this flowery, poetic language that can be really easy to just push aside and ignore. But when you actually get into it, you start seeing how much more they know and understand about how the human body shows up. And when you start treating the person in front of you from that artistic lens, all of a sudden their symptoms start falling away and the results actually stay. And so if the person's scared, it doesn't matter how much I open up the cervical spine and the mid thoracic and get range of motion into the shoulder, because the second they go back into life where they're spending predominantly more disproportionate amount of time out there than with me, the shoulder's going to come right back in, and then it's going to start causing all that irritation, inflammation, and it's going to be frozen up again because it's guarding. Right.
That's amazing. So frozen shoulder, like how many times they normally need to see you start to see like maybe some healing and they're getting better. I know everybody's different, but what have
Yeah,
you noticed?
it truly depends on the person. I've had people walk out of my office perfect after one session. And I've had people that it takes 6, 7, 8 months to get it to be sustainable, right? There literally is no way to guarantee any kind of result because you're working with their nervous system and it takes time to break the patterns of survival that the person is in. But when you get down and start unraveling this stuff, this is when the results stay. Like for instance, I have a client that's an inch and a half taller permanently now just because we've made so much length through the paraspinals because 25% of your it sounds magical, but 25% of your height comes from the disc space in your spine. And so if you have any kind of compression through the spine, if your paraspinals are being pulled down, if your head has any kind of forward neck posture and your shoulders are rolled forwards, you have any kind of anterior or posterior pelvic tilt, it's going to lower your height. And so an inch, inch and a half is pretty normal amount of distance that you can give to somebody if you're working on their body at this state, right? But it's only capable of getting there if you actually work with the person on whatever all the layers are showing up in their body. It's not just physical, right? It's not just I need to fix their SI joint. It's not just I need to increase chi flow through the lung meridian. Like there's so much more than saying just, right?
I like that. So let me ask you a question. If someone were to come in your office right now, how does that look like?
So I have a very comprehensive intake form, as you could imagine. It's got many different layers. It gives me a really good insight to not only the medical stuff that I need to be aware of to protect my license and to make sure I'm practicing within the bounds of my scope, but also just a very wide umbrella of all the potential things that could be disrupting them from diet, lifestyle, stress, water, alcohol, drugs, addictions, habits, anything that could potentially be playing a role in whatever they're bringing me. I also have a few questions that I ask them to really gauge their level of commitment to the problem. And then when they finally do finish that intake, I take a look at it. If it's I have a I had a client that was extremely PTSD, ex-veteran, firefighter. That person, I would meet them online first to do a deeper dive into all the different things that they gave me and really get a better understanding of what they need because I probably might need to refer out for some of this. This isn't something that I would deal with alone because if they have chronic issues that are not only physical but also mental, like maybe they need a psychologist, maybe they need a coach, maybe they need something else to help support to get them where they're going because the last thing I want to do is promise I'm going to get them better and only show up half the way that they need, right? So most of my work is just giving them a very clear this is the foundation that I see. These are all the things that could help you. This is where I help you, right? I never want to show up with my client as me being the only source of their healing, right? Now, if the person has a very small intake, it's easy. I might be the only thing that they need, right? And so that I'll just give them my schedule. They come in and we do an intensive exam. I do a functional movement screening. I do a couple movements that I have them do to really understand how their body is going, not just in a static posture, but through different squats, lunges, twistings, just to see where their balance is, see how their joints are tracking, see the fear response as their body is in balance, put them on the table, go through the normal orthopedic exam, get a really good idea of what's going on, and then we treat. That first session is usually 60 to 90 minutes, and then follow-ups are gonna be anywhere from 30 to 60 minutes usually. And so I'm with the client. We're doing deep work, we're doing adjustments, we're doing body work, we're doing fire cupping, we're doing acupuncture, we're doing whatever is necessary to bring their body to a state of this is where their baseline is, this is now where their baseline is.
Getting that blood flow going. So,
Exactly.
right, because a lot of people will come into your office, I'm sure, that have a lot of negativity and they're just stuck in that thinking, that stinking thinking. And I know that it's hard. You can't really work with somebody like that. So, how would you work with somebody like came to your office?
Work with somebody in my office in
Yeah.
that negative mindset.
Yeah. If they came in that type of mindset, do you work with them or you just kind of say, I don't think this is going to be a good fit? How would that work?
So I don't actually have a lot of people that come to me like that, surprisingly. Most of the people that come to me, they're like, I don't know why I'm here. I've tried all the stuff that you do. It doesn't work. I'm stuck. This has been a chronic problem. I don't know who else to turn to. My friend swears by you. That's like 90% of my clients. That those are the people that come to me. They're in like this unbelievably burdened state of hopelessness with their chronic condition. I seem to get all the chronic cases that nobody else could deal with. And I'm not advertising that anywhere. I don't know why that ends up being my primary base.
What are one of the biggest things that you've seen with chronic that you're like, wow, I don't think this is going to help, but it actually did?
Good question. What's a good one? I had a client with a really, really stuck hip. Like their chronic SI dysfunction would not fix no matter what I was doing. Right. This was pretty early on in my practice when I was just starting to incorporate all the martial arts components to it. None of the adjustments I was doing would get more than a week worth of benefits. It was like almost clockwork. At 6 or 7 days, the hip would start acting up and they would start getting the pain again. None of the acupuncture, none of the dry needling, none of the kinesiology taping was making a difference. I was trying different exercises with them and they were actually doing them. And sometimes they would get benefits, sometimes they wouldn't. Uh, I would say the turning point when it finally released, we were working one day, we were doing an acupuncture session, and I led them through a breath work while we were doing it. And as we were going through it, they had memories about a sexual trauma that they experienced that they totally forgot about having. And I'll spare you the details. It was not good. I don't want to trigger anybody that's watching, but she cried and cried and cried almost probably 10, 15 minutes just crying. I was just in there with her. At that point, we had taken the needles out. We just sat. We had the space. And then the following week she came in, she's like, "Hey, my hip pain's not here." I was like, "Oh, really? What'd you do differently this week? Is it the did you try the new movements or anything?" She's like, "No, actually, I just journaled a lot this week. I didn't do any of the exercises, but I noticed that when I woke up this morning to come in, I didn't feel it." She's like, I was shocked because I'm so used to coming in to tell you what's wrong so we can work on it, and it's gone." And so that was one of the, like, the biggest turning points where I was like, "Man, there's so much that we don't understand about the human body." And so for her to finally get to that point where she was able to, like, feel into that trauma that she's been carrying for so long, like, I didn't do that, right? Like, all I did was create safety for her to feel it. And then she finally felt it. She finally let go of it. She processed it.
But you were the conduit that God used at that moment, which is really cool.
Yeah.
A lot of people get weird when you say the word God nowadays, but it's like, whatever, okay, bang, everything up here, whatever. That's a good one. But the cool part was that you were used to create that safe place and she put her barriers down.
Yeah.
And I think that's like you said, there's nothing new under the sun. If I were to reiterate what you said, there's nothing new. And you have something that's powerful that a lot of people aren't tapping into, like Chinese medicine. If you could maybe break out to the audience, what does that really mean? I'm thinking, okay, I take an aspirin and I got some Chinese medicine. What is Chinese medicine? And just that'd be great if you can kind of expound on that a little bit.
All right. Well, for all the viewers, forgive me for my ignorance and my capacity to briefly explain 5,000 plus years of the most beautiful, spiritual, and amazing art I've ever had the privilege of learning. I'll try my best here, but definitely do your own research to look into this because it's so much more than I could ever begin to explain. To start it off, it's rooted in Taoism. And so I don't know if you're familiar with what Taoism is, but it's basically the the religion and science of life, of nature. Like the Tao is akin unconscious form, right? God is a conscious construct that cares, has unconditional love and all this stuff. The Tao does not have any feelings. It is the rhythm and flow of nature. It is the rhythm and flow and patterns of life and how everything exists, coexists, how action causes reaction. When you see the symbol that most people refer to as yin and yang, right? That symbol is the daiji, and the parts inside of it are yin and yang, right? So the daiji is the translation of the supreme ultimate or the grand ultimate. Like English just does not capture any of the translations. The ancient Chinese language is so unbelievably complex and poetic and beautiful. And when you actually have somebody that can translate what you're seeing, these characters that have so much meaning in them, you're like, oh my gosh, what I think I know is not even close. Like it's just so beautiful. But Chinese medicine is rooted in all this. So it's all about how is the universe inside of you manifesting, right? And so when you look at the way that they look at the body, we're looking at the body from a state of the frequencies that are coexisting within you. And the second one of the areas are out of tune with another one, this is when disease starts occurring because everything is supposed to be in this beautiful circular flow where one is consuming the other while the other one is creating the other. And the second that balance is not occurring, and notice balance too, I'll get into that in a second. The second that balance isn't occurring, you're going to have disease. This is cancer, heart disease, obesity, all these things, right? And so balance in Tai Chi or in Chinese medicine is totally different than balance from what we think of in a Western mind thing. When we look at balance, it's a scale, right? It's a weight, but balance only exists in death. The second there's not an unevenness, the second there's not that higher and lower, now we don't have flow anymore. True balance is flow. And so your capacity to give equal to your capacity to receive. The capacity to push your body and your capacity to give yourself permission to rest. I tell my clients this all the time. It doesn't matter how hard you're pushing your body, you can always push it more. You're just not aware of how to rest properly, how to recover properly. If you really want to expand your capacity to do more, to hold more, it is possible. You just don't know how to honor and receive yourself in that process. the movement you're doing is always going to lead to injury and burnout if you're not meeting it with recovery and repair at least equal, if not more, right? Than how hard you're pushing. And so that's how I make sure my clients are still moving forwards and doing everything that they're doing. But when we're looking at Chinese medicine specifically, we're looking at the body as a manifestation of our emotions. All right. That's the easiest way that I've understood it and how the framework that I look at it as. Because why are most people obese? There's a million reasons, right? But some reasons that I've seen in my clinical practice, when you look at the emotional undertone, has to do with fear, right? A lot of women that are obese that don't have a specific thyroid issue, but have an eating disorder, it's because they had some kind of history of sexual abuse or trauma. And this is a defense mechanism to keep men away, right? Why are men obese? Same thing, just the opposite end of the spectrum, right? They want to keep women away. They want to fulfill that part of their shame and guilt and spiral away, and it's an armor, right? And again, this isn't like a general coverall. This is just tiny aspects of what you can start untangling when you start overlapping all these systems, because they're not a direct one-to-one overlay, right? They're very much a cohesive different viewpoint. You got Chinese medicine looking at the art of existence, and Western medicine looking at the body like a car or a computer that's just a bunch of pieces that you can just cut out and replace the second they stop working right. You know, Chinese medicine looks at the body as an entire ecosystem. Your fascia would be akin to the mycelium network of the forest, your bones akin to the trees, your leaves akin to the areolae in your lungs. Like you have all these different aspects of existence moving through you. The arteries and veins, river systems, right? So that's a very
Amazing.
short and
Amazing, though.
missing a
Pe-
lot.
yeah, but I mean, I gave you a loaded question on that one, but a lot of people don't realize the power of that. I have had migraines my entire life, and one of the doctor friends of mine did some Chinese medicine on me, and I haven't even had a headache maybe 3 times in 2 years, maybe
Yeah.
three, but I used to get them almost every day.
Yeah, and that doctor didn't give you a pill. He gave you a concoction that he handmade from a bunch of ingredients that he has in his shop, right? And that's the difference between
Yes,
Chinese medicine and modern medicine is modern medicine we have very specific prescription drugs that have been studied and approved and do very specific things on very specific parts of the body acting on very specific receptor sites, and this is what it does. It stops this or blocks this or increases this, right? Chinese medicine, there is no one size fits all. They are so anti protocol. It is insane. If you try to get an authentic practitioner to give you a protocol, they'll laugh at you. They're like, no, it's not Chinese medicine then. Right. And so I think there's a married middle ground somewhere in there where there is room for protocolizing things just to make it easier for especially lower down the totem pole issues. But when you start getting to complex situations like that, where you have chronic migraines and you've gone to the places and you don't know the thing that's going on, they're able to figure out based on pulse diagnosis, based on your skin complexion, based on your tongue, based on how your body is manifesting through these symptoms, how your skin looks, how your breath smells, how your body feels, how your posture looks. And there's so much they're reading, right? They're tapping into your energy, your auric field, you're feeling into all this stuff. And then they're like, okay, this specific root is going to help. This specific herb is going to lower this that's causing this. It's all about that flow. It's looking at where the rivers are dammed and like, hey, let's take this tree out. Hey, let's dig a hole so more water can come. Like whatever is specifically necessary for your body in that situation. Right.
it's amazing. With what you're doing is you're bringing people in, and you're not just adjusting them. You're actually doing what chiropractic was intended for. They talk about blood movement, but you're actually getting the blood to move, truly move, not just with an adjustment. So people are learning how to deal with depression, how to deal with anxiety. That's huge.
Hmm.
I mean, I'm sure you've heard that from a lot of people with, like, you're a chiropractic master karate masters. Like this is, I mean,
Very kind, thank you.
I think that's awesome. I know if I was in there, I'd be like, I got to try this. I'm sure you get that a lot.
Well, whenever you're in town, come by.
No, 100%. I love what you do. And thank you so much for being here on the show. And you're going to not only get the chiropractic end, but you're going to get the end of the blood really flowing. And remember this, when your blood's not flowing is when you're in pain. And a lot of people don't realize that, my neck, it's because there's inflammation. Now, how do you get that? By doing, you got to be moving. How does it look? Is your classes, do you do it on the weekends or do you do it during the day? How does that look if someone were to go to your office and sign up?
For the martial arts classes or the treatments? Okay,
Martial
well,
arts.
the martial arts classes are only privately and then online. I'm working on finding a location where I can teach in person on a broader scale because I personally love teaching on in person more than online. Just being able to be there and actually show your body what it's capable of is so much easier than just being like, twist your shoulders. Because you'll twist and you'll be like, "Oh, yeah, I'm doing a great job." And then I can walk over and be like, "No, that." Like, this is how you get your spine to twist. All you're doing is contracting your psoas right now. Like, let's actually spiral through. Let's get those tiny muscles in between the spine to activate. Let's show your body what it's actually capable of, right? So yeah, right now I don't have any in person. I'm just doing the online and with privately with clients.
That's awesome, man. That's so, where is there a certain day that you're going to be, do you have like an idea of when you're going to start your own, maybe possible class in the near future, like in-house?
In-house, it'll most likely be on Fridays and or Tuesdays, one of the 2, maybe both. But we're looking at 'em in about a month or 2 is the goal.
Perfect.
Yeah.
Perfect. Well, thank you so much for being here on the show today. I can't wait to get this out to as many people as I can, especially in your area, because people need to know this. I mean, without movement, you have nothing. Blood is the life. You treat that blood incorrectly, you will have no life.
Yep, exactly,
Yeah.
exactly.
I
Yeah, this
appreciate you. And if you can give one tidbit to people that are looking at maybe joining you and on what you're doing, what would that be? And I'm giving you a bunch of good ones today.
pain is a message. It's not a problem. Pain is your body trying to talk to you. It's trying to guide you, it's trying to teach you, it's trying to get you to start caring for your body in a way that you refuse to. It's showing you where you're limiting your capacity. And so the more you can give yourself permission to stop forcing past it or running away from it and giving yourself permission to actually sit with it and start untangling what it's trying to communicate through that pain, then you're going to actually start taking back your power and movement will actually start becoming medicine.
Wow, that's beautifully said, my friend. Thank you so much for being here, Dr. Tom. In Austin, Texas, you can go to beastchiro.com, beastchiro.com. And real healing requires precision. And with precision, you have blood flow. Thank you so much, Doc, for being here. I appreciate it. And I look forward to hopefully seeing you soon.
Thanks, Mark Anthony. I appreciate you.